pandemic has seen soaring numbers of children in suffering eating disorders. Some statistics we've not heard yet today are between April and October last year, 4,238 children were admitted to hospital with an eating disorder. That's an increase of 41% on the figures of 2020 and an increase of 59% in 2019 when the figure was 2,508. That's a dramatic increase in eating disorder inpatients, which should be incredibly concerning to everyone in the House. Of all the mental health issues, eating disorders are the #1 killer. What perhaps even more concerning is that when those children and young people are admitted, the shortage of Tier 4 beds and a mental health practitioner means they are often placed in the wrong place in the system, and they are not receiving support from people who are trained in eating disorders. These are children who are suffering from acute mental health problems, who unfortunately are currently seeing restraint used regularly in health wards, not mental health wards. This is not a good intervention, and it is not an appropriate therapeutic pathway to have these acutely ill children in. They all deserve a Tier 4 bed for how ill they are, and who are not receiving any kind of mental health intervention at the moment means they are being treated only for the physical consequences of their eating disorder. That ignores the whole cause of it. Members in this debate have highlighted that we are failing our young people and children on the 4-week target. It's also vital that the care is finally provided is by the right people and not by people who are unqualified to meet their needs, as is happening up and down the country to thousands of children with eating disorders. Or else there's a real danger that the system actively contributes to making their mental health problem worse and harder to treat. On that point, I wonder if the Minister has available the figures on the use of physical restraint in acute wards that are not mental health wards, where children with eating disorders are.